Hi guys. Okay, so today we are going to touch on in this video some upper respiratory medications such as antitussives. We're going to talk about expectorants and mucolytics and even some decongestants. Okay, so let's start with the antitussives first. Okay, your antitussives are going to be for a non-productive cough. Okay, non-productive cough, and you have two types. You have types that consist of opioids, okay, and then you have non-opioid antitussives. All right, so your opioid antitussives would be your hydrocodone and your codeine. Okay, these are going to suppress the cough through the action of your CNS. Okay, to increase the cough threshold. Okay, so it's going to target the cough center in the brain and tell it to chill out. All right. It's used for chronic non-productive cough, as I mentioned, to decrease the frequency and the intensity of the cough. All right. And then you have non-opioid. Okay. Non-opioid is the other type. And this is the dextromethorphan and benzonatate and diphenhydramine. Okay. The dextromethorphan suppresses the cough through the action on the CNS. It's not an opioid, okay? It's not technically an opioid. It's still considered a non-opioid, but it has opioid derivatives, okay? It has opioid derivatives, so we want to be cautious of some CNS effects that could occur, all right? But it's ultimately going to help with cough suppression. It could also reduce some pain when combined with an opioid, okay? Further on your antitussives, it has a central, peripheral, and local nervous system effects in the body. Okay, and it is often combined with other drugs. Okay, a lot of your common cough medicines and common cold medicines contain dextromethorphan. Okay, so they're used in combination, and it could be purchased over the counter. Okay, your non-opioids, except for your benzonatate, but the other two can be purchased over the counter. A lot of times they just card you for it. Okay, and the reason why they card you for it is because of that derivative of that opioid. Okay, but they can be used in combination with codeine as well. If it has codeine in it, then it's going to require a prescription. Okay, and as I mentioned, codeine is going to depress the cough center in the brain. Without codeine, it acts only peripheral and locally in the body. Okay, and that's why those others can be sold over the counter. Okay, some of your adverse reactions or side effects consist of drowsiness, dry mouth, nausea, and postural hypotension. Okay, for interactions, your antitussives with the codeine have an additive effect, okay, with other CNS depressants, and it can increase the analgesic effect of aspirin. All right. Next, I mentioned we were going to touch on your expectorants and mucolytics. Okay, your expectorants and mucolytics decrease the thickness, okay, of the respiratory secretions, which facilitates the expectoration, expectoration to get off that mucus. Okay, so it's going to help thin it, and help get it out. All right, you have guaifenesin, which is your mucinex. Okay, that is the mucolytic. And then you have your acetylcysteine, which smells like rotten eggs, ew, okay? And then you have hypertonic saline, okay, which is gonna help thin out that mucus, okay? So I mentioned the uses kind of already. This is used to treat a productive cough. So the other ones was non-productive. This is productive, okay? Used to treat a productive cough as it assists with thick mucus and secretions, okay? It's gonna help to thin out that mucus and help to get it out, okay? It could also be used in patients with cystic fibrosis, okay? Acetylcysteine is also an antidote for acetaminophen poisoning, okay? GI upset is the most common reaction that could occur with these medications. There could be some dizziness, drowsiness, hypotension, tachycardia, even hepatotoxicity. Okay, expectorants may increase bleeding tendencies if your patients are taking anticoagulants. Okay. Next, or last, the last topic that we're going to touch on is decongestants. Okay. These are sympathomimetic drugs. All right. You have your, I'm going to butcher these, Afrin. Okay. Afrin, the generic to Afrin is oxymetazoline nasal spray. You have phenylephrine spray or drops, which is that neosynephrine. And then you have phenylephrine oral tabs and liquids, which is that good old Sudafed. Okay, you have pseudoephedrine, which is another form of Sudafed, and Dimetapp. And you have ephedrine. Okay, these directly affect the alpha receptors in your blood vessels in the nasal mucosa. Okay, that's causing the vasoconstriction. So when you take these, all right, it's going to reduce the swelling in your nasal passages. Okay, the use for this, again, reducing that nasal congestion in your nasal passages that came from either allergies or even upper respiratory infections. Okay, this is supposed to have a local effect. Okay, but if it's used improperly or used excessively, it can cause some irritation. It can cause dryness of the mucous membranes in your nasal passages, and it can also cause something called rebound congestion. Okay, rebound congestion is where you're using the nasal spray and it goes away, you use it, but once you start to abuse it or use it more often than you should, it's like that congestion comes back with a vengeance and it doesn't want to go anywhere. Okay, that's that rebound congestion. Okay. Also, I do want to touch on sympathomimetic nasal sprays that are overused. Can also enter the bloodstream. So as I mentioned, it's supposed to be locally. It's supposed to stay intranasally in the nasal passages to relieve the congestion. But if they are overused, it now starts to enter the bloodstream. Okay, once it enters the bloodstream, it can cause some nervousness. It can cause insomnia, tremors, heart palpitations. Okay, this is also contraindicated. Key thing. Contraindicated in patients who have closed angle glaucoma. Okay, and that's all for this video. Happy studying.